All right. Thanks, Michael. All right. Good morning, everyone. Thank you for joining us for day 2 of the NMFMA 2022 Local Food Connects Annual Conference. We're really excited that you're able to attend, and we hope that you take away lots of valuable information today and over the next few days that you're with us. I'm Sophia Rose, and I, along with Michael Green, are the tech assistants for the duration of the conference. Before we get started, I'm going to go over just a few housekeeping items that will help the conference go more smoothly. If you were with us yesterday, this might be a little bit of repetition, but just bear with me. We'll be using the same Zoom link throughout the entire conference, so be sure to keep it handy. You will also receive a daily email with that link and important documents in the agenda for the day. You can use this to keep track of the exciting content and support that we offer. On your Zoom screen, you will see 3 important buttons at the bottom of the window: your chat icon, reactions, and leave meeting. You will use these 3 buttons throughout the conference. In the chat, feel free to introduce yourself, ask questions, make comments, ask for technical help, etc. After you open the chat screen at the bottom, just above the text box where you type, you'll also see that there's a drop-down menu where you can choose who to send a chat message to. You can select it to send it to everyone or the panelists for specific questions. During the Q&A, you'll see the reactions button. We ask that you use that to raise your hand. And when you're finished, you lower your hand. The moderator or tech assistant will call on participants who raise their hands, and that's how we'll go through the Q&A. If you ask questions throughout the session, we'll also be keeping track of those to ask at the right time. Finally, you will use the leave room button to exit the session. I would encourage you to leave the room during the lunch break and at the end of the day. So you have all entered the room as active participants, which means you have control of your audio and video. We love to see all your smiling faces, so please feel free to keep your camera on. However, we would appreciate your help in allowing the speakers to be heard clearly. So please keep yourself on mute unless you're speaking. The tech assistants will mute you if you forget to mute yourself. So you should only unmute if a moderator or a tech assistant is calling on you. If you have any tech issues at all, please contact me or Michael Green. I'm going to drop my contact info in the chat right now, and it's also on the agenda and daily email. Okay. So now for the fun stuff. For active NMFMA members in good standing, please don't forget to vote for your new board members. Voting to fill the board positions is now open and will close on Friday, February 25th at 5 p.m. So you've been emailed, if you're a member in good standing, you've been emailed the link to vote for these open board positions. So finally, I'm just going to give you a quick rundown of the sessions for today. From now until 11, we're going to be with the NMFMA's Double Up Food Bucks Program Manager, Sarah Thompson, and NMFMA FreshRx Program Coordinator, Kirsten Hansen, at the mandatory Double Up Food Bucks and FreshRx session. Please note that this is a 2-part session, and both are required. So make sure you come back after the lunch break. From 11 to 12, we have our lunch break. And then from 12 to 2 p.m., we're gonna come back together for the second half of the Double Up Food Bucks and FreshRx session. Now, without further ado, I will hand it off to Sarah Thompson, who is going to begin today's programming.
Okay. Hi, everybody. Kirsten and I are here together, so we're sharing the screen, but she's got her computer. Any questions in the chat?
Good morning, everyone. And it looks like a few of you have already figured it out. If you wouldn't mind going into the chat and giving us your names and the organization that you're with, so everybody can sort of see who else is here. If you're comfortable taking yourself out of the dark and turning on your camera, that's great too, even if just for a few minutes so we can see each other. It's not a requirement, but it's always really nice to see who's here as well. We're going to have 4 hours together today. And although Sarah and I have tried really hard, there's no way to make this super fun. This is simply training. We wish it could be a little less detail oriented and a little bit more, active, but really we're going to be going through all the nitty gritty of how to run Double Up Food Bucks, SNAP, and FreshRx at your outlet. I know a lot of you are veterans. You've been doing this for a long time. You actually know it better than I do because I've only been here for a year. But we do realize that almost none of us, including Sarah and me, none of us gets it right all the time. So we will be going sort of back to the beginning, and we hope in a logical, methodical way, going through all the steps necessary to keep everything on track. And with that, I think we'll bring up our slides.
Sure. The other thing about going through all of the things from the beginning is we do have new market managers and returning market managers this year because we've got the new grant. So Double Up used to get paid for by a grant called FINI. Now it's paid for by a grant called GusNIP. It's the same grant with a different name, but it also has a lot of different new requirements and new product eligibility that's more expanded. So that's very exciting.
Give us a second to bring things up. And again, welcome. This morning, we will be doing both slides that you're used to with PowerPoint. We have a video to share with you. We have a keynote speaker who was also recorded to share with you. And then this afternoon, we have a special guest coming back right after lunch to present about FreshRx. So we're trying to change it up a bit, not just slides, but also video and guest speakers.
And so this morning, we're going to go over some introduction and a keynote video, and then we're going to talk about laying the groundwork for your program, all of the basic things that goes into running a Double Up or a FreshRx program. And then in the afternoon, we're going to have the guest speaker. I've got a few slides about technology solutions because a lot of you guys are growing to a place where keeping paper records is maybe not the best solution to running the program. And then we'll talk about new eligibility rules and the vendor training.
But first, and maybe most importantly today, but first, we really have to take just a second to thank all of you and to recognize what an amazing year 2021 was for Double Up Food Bucks, for SNAP, and for hopefully for most of your markets. Sarah has been at this for a long time. She's worked really hard. And I think if you take a look at this graph, you can see how far Double Up has come. And it's all really been a team effort, right? Sarah is on the back end trying to make sure everything runs. Denise Miller helps write the grants. Our entire staff is tuned into Double Up. But it's really just as important to thank all of you for everything that you did to make Double Up such a huge success. Sarah, you want to tell them the numbers?
So we're up to 32 farmers markets and 32 grocery stores. Even though there's the same amount of markets and grocery stores, the farmers markets are still doing about half of the Double Up Food Bucks redemptions. And then there's 14 locations that aren't a grocery store or a farmers market. So a CSA or some of the food hubs are starting to have produce boxes. And last year we redeemed $2.5 million of SNAP and Double Up at all of the outlets.
Hold your sign. Okay. So we wanted to thank you all. We have balloons, we have signs. We really do want to thank you for everything you did this year. We really think it's a time to celebrate our successes, even though it was kind of a rough year for most of us with COVID. we'd like to say cheers to another really great year in 2022 as we launch a new grant. And thanks for all that you did last year to make it work. It's not local. All right. In addition to Double Up doing really well, we launched FreshRx. It's a much smaller program, as you all can see, but we like to start small here. Think local, think small. FreshRx, as most of you know, is a produce prescription program, which means we're cooperating with our local health clinics to send patients to the markets and also participate in a few CSAs. And we did about $70,000 in redemption this year, going into the farmers' pockets, about $70,000. Really not anything close to the 2.5 million. But what's exciting about this graph is that we can see that when we're on these big calls with people running programs like this all across the country, they expect about half of the vouchers that the health clinics hand out to actually show up at the markets and get redeemed. And our markets is way better than that. We actually sent out about $70,000 worth of vouchers, and $50,000 worth of them actually got used, which means that, we are doing better than the national average, that folks must be pretty comfortable at our markets. And I'd like to take a second to thank you for that as a FreshRx coordinator. You're doing something right when people come on a Saturday morning or a Friday afternoon and they choose to stay and shop and then hopefully come back again. And I'd like to really thank you all for creating that atmosphere, and the farmers as well for having the goods that people want to buy. So thank you. Thanks for that, you guys. We appreciate it. We really do.
Also, you guys who get to work with Kirsten have a special treat because she's so much sillier than me. So.
Next. All right, Sarah's going to walk us through technology here. Everybody ready?
All right, so there is a website that we're going to have you guys go to. It's called Mentimeter, but what it's going to do is you're going to answer this question with, I think you can enter up to 2, maybe 3 words, and it'll make a word cloud. And we'll pull that up in a minute when everybody is done. So you go to www.minty.com and use this code right here. That's 24086312.
And when I do this, I cheat. I go to Minty on my phone sometimes. It's totally up to you how you want to get there.
So the question that you'll answer is, what are you looking forward to this market season? She'll put it in the chat right now.
It's coming. Give it a shot.
So while you guys are doing that, we're going to play a recording from the Nutrition Incentive National Convening, which is a conference that happens every year, a few weeks before this conference. And this year it was online again. And so we had a speaker from the USDA that Kirsten and I really appreciated all of the things that she was saying. It also gives kind of an idea of what the USDA wants to do moving forward. So we're going to watch a video from Dr. Sarah Bleich. She is the Director of Nutrition Security and Health Equity at the Food and Nutrition Service at the USDA. That's FNS, or the place where you get your SNAP permit from. She was previously a senior advisor for the COVID-19 for the Office of the Secretary of the USDA, and she's also been a professor of public health policy at Harvard. So we will watch this video while you guys do the Mentimeter.
I want to thank you for joining us for this important and extremely timely conversation about the role of nutrition security incentives and how they can impact nutrition security. We are living in a time that has placed extraordinary stress on American lives, leaving millions of families struggling to make ends meet and put food on the table. These difficult circumstances offer a unique opportunity for our country. It's an opportunity to not just build back, but to build back better than ever before. And to achieve this outcome, the president has proposed a broad, bold, and transformative agenda that makes long-term investments in Americans and America itself. And that agenda touches every aspect of USDA's work. Later today, the Secretary will deliver a State of USDA where he'll discuss the department's 5 key goals. The first is addressing climate change via climate-smart agriculture and forestry. The second is advancing racial justice, equity, and opportunity. The third is creating more and better market opportunities. The fourth, which is very relevant to everyone here, is tackling food and nutrition insecurity. And then the fifth is making USDA a great place to work for everyone. It's exciting that the Secretary is so passionate about nutrition security since so much urgency is needed on this issue. Secretary Vilsack recognizes that USDA's core nutrition programs are the most far-reaching, powerful tools available to ensure that all Americans, regardless of race, ethnicity, or background, have access to healthy, affordable food. And this includes the work each of you do in GusNIP. So I'd like to take time this morning or afternoon, depending on where you are, to outline how we're prioritizing and promoting health through our federal nutrition assistance programs and how these efforts tie into the vital work that you're doing around nutrition incentives. And my remarks aim to set the stage for my colleague, Dr. Carrie Castile, who's the director of NIFA, who will provide tomorrow's keynote on NIFA's administration of GusNIP in partnership with the Food Nutrition Service. So let's begin with what's been top of everyone's mind since about March 2020, which is the pandemic. Now, throughout this unprecedented public health crisis, much has been said about the problem of food insecurity, and that makes sense. The latest US Census data confirms what we all know, which is that a huge number of adults currently do not always have enough to eat, and that's 1 in 11. Food insecurity is a condition that creates enormous strain on worker productivity, healthcare spending, and military readiness. And this is heavily shouldered, as you well know, by communities of color, persons living under the federal poverty line, and citizens in rural and remote areas. We also know that the statistics for food insecurity are higher among certain populations, so it jumps to 1 in 6 among Black adults. But food insecurity is only one side of the coin. At USDA, we are committed to also promoting nutrition security, which is the consistent access, availability, and affordability of foods and beverages that promote well-being and prevent, and sometimes treat, disease. And this is particularly among racial, ethnic, minority populations, lower income populations, and rural and remote populations. The concept of nutrition security builds on and complements our work in promoting food security by recognizing that we're not all maintaining an active, healthy life, and emphasizing an equity lens to our efforts to ensure access, availability, and affordability to foods and beverages. Now, to tackle these twin challenges that often coexist, USDA is working to strengthen our programs and remove any barriers to make sure all individuals and families have a reliable nutrition safety net, one that not only gives people calories, but gives them calories that count. And as of this week, I'm extremely excited to be fully focusing on helping the department to use all of its tools, including the relationship with key communities like GusNIP, to tackle food and nutrition security. Without question, nutrition security is complex and brings with it lasting negative consequences. As you know, right now, diet-related illnesses are a leading source of poor health in the US. In fact, nearly 3 in 4 American adults has overweight or obesity, and 1 in 2 have diabetes or prediabetes. These rates continue to climb, and Black, Latino, Native American individuals, as well as persons living in rural and low-income counties, suffer the greatest disparities. As the health problems facing our country continue to shift, it is critical that we also transform how the federal nutrition assistance programs operate to promote nutrition security, such that those who qualify are able to participate. Those who participate get benefits that are meaningful, and those who receive those benefits can use them conveniently and in ways that promote improvements in their health and well-being. Ultimately, this can help reduce healthcare expenditures, increase the purchase of local foods, and help break the cycle of racial inequity, as well as grow military readiness and even mediate climate change. To put it mildly, there is a lot at stake. And with the help of committed stakeholders, local leaders, and vested partners, we can expand and bolster our programs to move the needle toward nutrition security for all Americans. In FY22, the USDA will build on the innovation required by our COVID pandemic response, as well as the historic investments in the food and nutrition assistance that we made in FY21. We will also invest in bold solutions that enhance food safety, improve our nutrition programs, and reduce both food and nutrition insecurity. I am excited for the work ahead to promote food and nutrition security, recognizing how our work in this field is a critical ingredient to recovering from the pandemic, ensuring racial equity, rebuilding the economy, addressing the impacts of climate change, providing open markets and fair trade, and reinvigorating our competitive workforce. So let's start with the youngest members of our society, many of which are served by the GusNIP community. Thanks to the WIC program, income-eligible moms and their children up to 5 years old can receive the specialized nutrition, resources, and healthcare referrals they need. The program provides the foundation that helps families thrive now and long into the future. Research indicates that participation in WIC is associated with stronger health outcomes, including improved birth weights, lower infant death rates, and fewer premature deaths. It's even been shown to improve long-term health outcomes for children. Notably, the science-based update to the WIC food benefit implemented in 2009 was associated with increased consumption of whole grains, fruits, and vegetables, and a downward trend in obesity within a significant sample of preschool children. But unfortunately, as of 2018, less than 6 out of 10 eligible women and their children were enrolled. So moving forward, it's crucial that we make sure as many as possible of those who are eligible can benefit from WIC. It's why the President's American Rescue Plan Act of 2021 includes a historic investment in WIC, which USDA is working hard to utilize to improve program delivery and boost participation and benefit redemption among eligible families. That is, our key goal to strengthen WIC is to introduce more eligible families to its benefits and services and keep them in the program so that they can continue to benefit. This will improve health for infants, more nutritious diets, and better healthcare for children, and higher academic achievement for students. We believe that connecting more eligible women and young children to WIC is one of the tools to reduce stark racial disparities in our country. Further supporting children's growth and development are USDA's meal programs, which serve nutritious breakfasts and lunches to students across America. A little over a decade ago, we saw tremendous progress achieved through the 2010 Healthy Hunger Free Kids Act. A recent study in JAMA found that during the decade, schools became the most nutritious source for American children, school meals, I should say. Similarly, a USDA study of meals prepared under the new standards found they contained higher proportions of vegetables, whole grains, and dairy foods than prior meals, not to mention lower proportions of refined grains and empty calories. Recently, we adjusted school meal reimbursements by an estimated $700 million to help schools serve healthy meals to children during the rise in food prices. Before moving on, I do want to acknowledge that the school meal programs have not been immune to the challenges of the pandemic. Many of you in the GusNIP community are aware of these supply chain and labor force challenges. Since the start of the pandemic, school nutrition professionals across the country have put forth tireless efforts to prepare and serve nutritious meals, no matter what the circumstances. To help them be successful, USDA has been offering states and schools a wide spectrum of flexibilities, resources, and hands-on support to help them adapt to any issues and unpredictability they may face this school year. Still, we are aware that some schools are experiencing trouble purchasing and obtaining food for their meal programs, and we're taking swift action to ensure that doesn't interfere with their ability to serve nutritious meals to the children in their care. Recently, we announced up to $1.5 billion in funding to help schools purchase foods, enhance the toolbox for school nutrition professionals working hard to make sure students have reliable access to healthy meals. And we continue to provide flexibilities and support to give them the tools they need to deal with the situation on the ground. Next, I'd like to talk about an effort that's enriching not just the lives of infants and children, but entire families in need. It's one of the most significant changes in the nutrition security space in quite some time, and that is the reevaluation of the Thrifty Food Plan. For those not familiar with the plan, it It serves as the foundation of the SNAP benefit calculation. USDA was directed by both Congress and the Biden administration to reevaluate the plan based on updated data and nutrition knowledge. Using the latest available data and evidence-based process, we brought the plan up to date with the current realities of low-income shoppers, a formula that considered both consumers' real-world circumstances and notable shifts in the marketplace. This resulted in the first permanent increase to the purchasing power of SNAP benefits since the Thrifty Food Plan was introduced 45 years ago. In its reevaluation, USDA was driven by the latest available data on 4 factors: current food prices, what Americans typically eat, dietary guidance, and the nutrients in food items. The revised plan budgets for more foods needed to align with the recommendations, the latest dietary guidelines for Americans, like fish, red and orange vegetables. It's an action that provides low-income families with better access to healthy foods. Foods, frankly, that can go a long way to prevent disease, support children in the classroom, and reduce healthcare costs that can weigh heavily on household budgets. It's also a step in the right direction to ensure all Americans, regardless of their background, can afford a healthy diet. Another significant way we're supporting SNAP participants is by expanding online purchasing. Today, millions of SNAP participants across the country can shop and pay for their groceries online. We continue to work with interested retailers and companies that are looking to expand online shopping options. And just as the Thrifty Food Plan better reflects today's costs and nutrition needs, online shopping options empower SNAP beneficiaries to purchase food the same way more and more Americans do, by shopping online. And the epic growth of this program has been astounding, especially when you consider that SNAP online purchasing was launched as a pilot in just 1 state in April of 2019. Fast forward to the Vibrant program today. In response to the pandemic, we've been able to extend online purchasing to 47 states and the District of Columbia, increasing convenience for many SNAP shoppers. Last, but certainly not least, I want to recognize GovSNP, an innovative and impactful program that would not be possible without each of you. Congratulations on your year 2 findings. It's outstanding to read that this community distributed more than $20 million in nutrition incentives and produced prescriptions redeemed, and generated an economic impact of about $41 million. And GovSNP participants reported greater fruit and vegetable intake and experienced improvements in food security. Tomorrow, Dr. Castile will dive deeper into the tremendous gratitude we at USDA have to this community for your tireless efforts to quickly adapt and innovate during the COVID-19 pandemic. The work this community has done and is still doing during COVID-19 to help provide invaluable nutrition incentives and produce prescriptions to increase access to fruits and vegetables among low-income participants is impressive. And the Secretary is committed to helping ensure we can do all we can to guarantee the successful implementation and growth of this program. In closing, I want to be sure to leave time for questions. So let me wrap up by thanking you for your attention to these critical issues. You probably noticed that I referenced quite a bit of data this morning, and that's not by mistake. All that we do is driven by research and grounded in science. It's woven into our policies, informs each of our decisions, and most importantly, impacts into every life we touch. The GovSNP community plays such a critical role in ensuring we have the data to demonstrate not only food nutrition security impacts of GovSNP, but also the program's ability to impact the lives of participating farmers and retailers while having positive economic ripple effects in the surrounding community.
All right, so I'm gonna have Kirsten pull up on her screen the answers to the Mentimeter word cloud. And in the meantime, if anybody has questions or comments about what Sarah was talking about, you can go ahead and take yourself off mute and do that.
We're getting there. All right.
So this is what you guys put into the Mentimeter poll, and it looks like the answers that came up the most were growth and community, which I think are great things. And we've also got fresh food access, growing our markets, seeing our customers, having more variety. That's a great goal and something to look forward to. Sunshine, I can definitely get behind having more sunshine. Got prosperity and new vendors, happy faces. Those are all great things to look forward to in the coming year.
Somebody put down traditional agriculture. Do you want to let us know more about that thought? Take yourself off mute, whoever put that in. Anybody feel comfortable sharing?
Hi, that's my comment. Traditional agriculture to me is practicing what our ancestors have taught us. And as a New Mexican who has been here since time immemorial, honoring the traditions that I have been brought up with, that my elders have been brought up with, that they've learned, the way that they've learned to not only farm, but use the water and save the seeds, and the bottom-up approach of we speak for ourselves and we advocate for ourselves. And all of that comes into traditional agriculture.
Yeah, that's really beautiful, Jessica. And it's something that, there's always a tension. So what we just saw now, with our speaker was sort of this from above approach, right? It's the USDA coming in and they have amazing resources that they're going to help us with. They have incredible data and incredible research. And I really feel like in that keyword that we all had in there of growth, I feel like the USDA is 100% behind us right now, trying to grow our programs. And I'm hoping that we can all walk that line between the outside and all this opportunity with money and growth, and remembering our roots and staying local and staying focused on the populations that we serve and our customers and our farmers. I want you just all to know that both Sarah and Denise and Christina, the whole staff, and I are always thinking in terms of that as well. We know these are really large federal programs, but it's up to us to make it work in our local environment. And we rely on all of you to help us do that. I also feel like what we should think a little bit about after listening to Sarah there on the, not this Sarah, the other Sarah on her keynote, what I think the takeaway that I really hope that all of you have is beyond the idea that there's more resources coming toward us. There's more and more money going on people's SNAP cards. There's more and more focus from the USDA on farmers markets and healthy eating. But if you listen to her last few sentences, she was talking about data, she was talking about science, and believe it or not, that's what we rely all of you on for. We rely on you for the numbers and for the feedback, but especially the numbers that we can then send on to the evaluators. And that is how we continue to be able to make a case for growing these programs in New Mexico without end of year reporting. And we all hate end of year reporting. Without that, we would not be able to make a case for more money for these programs, for new grants, for new ideas. So I'd really like to thank you again for all the detail work that you do. And that is why we're digging down into the details today, because it's so important to be able to provide the numbers to the folks when they ask for them so that we can make a case for continuing our programs with all of you.
And there's also, those of you who've been around for a while probably remember quarterly reporting, and that has been switched at the USDA's level to a monthly reporting now. So the weekly online reporting is going to start looking different, and that's always been due every 2 weeks. It'll start being due every month, but I'll have a lot less leeway on having people turn in their information late. So that's just something for everybody to be aware of. Of course, everyone has, every year there is someone who has something that happens that is completely out of their control, and something is going to be really late, which I understand completely. But as a general rule, we should all start paying a little bit more attention to when monthly, used to be weekly, now monthly online reporting is due. You might still give me weekly information if that's how you're outlet is set up to give information, but it's just due once a month instead of due once every 2 weeks. So with that, let's get into starting a program at your farmer's market, which looks a lot like the same thing as if you're getting a new market manager at your outlet. So whether your market is or your farm stand or wherever is having a new program of Double Up or FreshRx, or your outlet has had one of those programs or both of them, and you're coming in as a new market manager, this applies to you. The first thing that you have to do is you have to go to FNS, which is the Food and Nutrition Service, which is with the USDA, and it doesn't have anything to do with NMFMA. You go to their website and you apply for an FNS permit. So it takes about 6 to 8 weeks. You do it online. There is an 800 number that you can call if you have questions. Pretty much all we can do to help with this process is to give you the 800 number and tell you to call them, which I've got it in the next couple of slides somewhere, so you can write it down if you need it. But these numbers are tied into the market manager or the business owner's social security number. So if you're at a market or you're the manager or owner of a not farmer's market that is doing Double Up and that changes, if you don't make sure that you get the new FNS number and the previous manager doesn't let go of their old number, then the old manager is legally responsible for everything that's happening with that EBT machine at the outlet. And you as the new manager are not going to get really important information. Like you won't get information about if there's going to be a new EBT machine coming from the EBT machine company. You won't get a notification if you need to renew your FNS number. And if they send the letter to the old market manager about renewing and it doesn't get renewed, then your EBT machine and your FNS number are just going to stop working one day, and you're not going to be able to run any SNAP transactions. You're not going to know what happens. And it's going to take 6 to 8 weeks to get a new FNS permit. And 6 to 8 weeks, if that happens in July, you're going to be up a creek without a paddle for pretty much all of the season. So it's really important to think about this during a transition and be aware of the fact that it does take 6 to 8 weeks. So if you're a new outlet, a new farmer's market or farm stand, and you don't already have a valid FNS number in your name, then you need to get one. And we'll have the website on the next slide, which I can pull up. So that's the website where you apply for the FNS number. And if you're in a new market manager at an outlet that has been doing Double Up or FreshRx, then you also need to do this.
And somebody has, I think Sylvia, do you have your hand up? Do you want to take yourself off mute and ask us a question? Or was your hand up by mistake? I guess not. Anybody else want to take themselves off mute? Anybody have any other questions about this? It's pretty straightforward, but you know, it can still be confusing. All right, Sarah.
All right.
Well, Sylvia has her hand up again. Sylvia, can you unmute
Okay.
yourself and ask your question?
Thank you, Michael.
Oh.
Or you can put your question in the chat, Sylvia, whatever works for you.
You can also push and hold your space bar to make yourself unmute.
George is right. Well, Sylvia, when you're ready, we'll circle back.
All right, so we've got, I was just talking about FNS, which is the Food and Nutrition Service, and that's where you're gonna get your FNS number. They're a government agency. They'll give you your permit. And here's the phone number for them. It's 1-877-823-4369. They will only talk to, once you have the FNS permit, they'll only talk to the permit owner. And so you'll need to have your permit number available to speak with them, and you'll have to tell them your name. And then there's a separate company called FIS. FIS is a private company that provides EBT machines and does EBT processing in New Mexico. And they have a contract with the Human Services Department. If you have problems or questions about your EBT machine or your EBT transactions, then you should call FIS. Our contact's name is Mark Nelson. If you need his contact information, I can provide it. It's also in your manager guide. And these machines do run off of AT&T, T-Mobile towers. So if your outlet location does not have service with AT&T or T-Mobile, then you'll need to find another provider, another solution, which we can help you with if that's something that you need. You're not required to use the FIS EBT machines or to use them as your processor, but they are low-cost options for markets. You'll get a wireless one from the state. The state leases wireless machines for markets. And if you're a direct sales outlet, so your single point of sale outlet that would not qualify for one of the wireless machines, you can get a wired machine, but those machines require you to have a phone line available at your location.
Looks like Carrie has a question.
Yep.
No, Carrie?
Yeah. I was just wondering, I know you guys said they'll only talk to the FNS permit owner. Can we put more than one person as, like, we put 4 board members as the permit owner, and then if any of us needed to call, we could call and let them know. And then, like, as the board members switch out, it's just like updating, going in and saying this person is leaving and this person is coming on. Do I have that right in my head, or if you don't know, it's okay.
If you want to have more than one person on the permit, it does get a little bit complicated. If you're just a business and there's like 2 owners, then that's pretty cut and dry. They'll do it. It'll take a little bit closer to the 8 weeks instead of the 6 weeks because they run a background check on everybody who's applying. There is a way to apply for an EBT machine that the whole entire board can be on the permit. That does take a little bit more work. It does take a little bit more time. If that's something that you're interested in, I would suggest calling FNS before you apply at that 1-877-823-4369 and asking them what they'll need from you so that when you go to apply, you'll have everything you need, because you can do it. It is complicated. The same thing goes for if you're a CSA model and you want to have more than one location. You can't, well, I mean, you can take the wireless EBT machine to different places, but they have a GPS locator in them. And the FNS can see if you move your machine around and you're using it at an unauthorized location. And if you're doing that, they'll not like that very much. But if you call them and you're like, I want to apply, or I want to change my permit to having these other different times and locations that my EBT machine will be used at, you can do that. They're going to ask for a whole bunch of different information that you'll need to provide, but it is possible. You should really talk to them before you try.
Okay, yeah, I'm just, I'm sure you guys know, I'm just concerned that what happened last time might happen again to us, and then we lose it and we're in this situation where we're like, who's in charge? We have no idea what's going on.
Sure, yeah.
So,
Definitely,
so-
absolutely.
Okay, we'll give them a call and I've looked in at the application before online, but we'll just give them a call and kind of talk through our situation and see what they think could be best for us.
Yeah, I've very rarely hear anybody tell me that the folks at the FNS at the retailer helpline have been less than helpful, because most of the time, if the person you're talking to doesn't really know, which happens sometimes, because if they get a new employee in, the first few times they deal with farmers markets, they're like, I'm not really sure what's happening here, but they'll bump you up to some sort of like manager, and the manager will get back to you on email and they'll be really helpful. So most of the time the person who's on the phone will be able to help you, and if they can't, they're very willing to bump you up to their management team to help you out and help you figure out what you need. But yeah, I mean, I definitely understand the desire to not want to accidentally create more problems than solving them.
All right, cool, thank you.
And Jacqueline?
Yes, I missed some of that. I had another situation here at the location, but is that phone number here, this 476, is that the number we would call to get help with that, or is that a different number?
It's
With
the
the
877 number that's on the left side of the carrot.
Oh. Thank you so much.
And all of this is in your manager guides. Hopefully you all got a lovely package from us with colored pages with the 3 holes already stamped in there if you want to add it to a binder. And so we have lots of ways to torment you with details. We have our slides today, we have our videos today, and we have the market manager guide. So feel free to use all of those.
And if you did not get the manager guide in the mail and you need one, shoot us an email and we'll send one out to you. It seems like a few people got lost in the mail, because we've been contacted by a few people that I know. I remember putting a label on an envelope. So if you didn't get it, then let us know. We'll send another one. You can also download it off of our website in the Market Manager portal if you prefer to do that. It's doubleupnm.org. You scroll to the bottom, you click Market Manager Login. I have a video in a minute that will show all of that, but the password is Apple. And then you find, if you're a FreshRx market, Double Up and FreshRx, there's one section for your paperwork. There's a section for Double Up only. If you're FreshRx only, sorry, you have to go back to the Double Up and FreshRx, and then there's a single point of sale. So
We'll get there.
Right. Loretta.
Good morning. I was wondering if you had that number for Mark Nelson that you said you might give us.
Oh, sure. Let me look it up on my phone, because I forgot to put it in the slide.
He's going to be so happy.
Yes, he can be kind of hard to get a hold of, but if you are having an issue getting a hold of him, then let me know and I can ask the Human Services Department what is happening, and then he'll pay attention to us.
That's not right. Ignore what I just put up there. I was reading wrong off her phone.
So it's 1-800-737-5834. And his email is, Kirsten will put it in the chat.
Yes, I will. You keep going.
So if you're a farmer's market in New Mexico and you get your FNS permit, Mark Nelson will contact you. You don't have to reach out to him about sending you an EBT machine. So you don't have to worry about it too much. Sorry, I got distracted by me. Sapan's message about Mark. Yeah, I mean, he's hard to get a hold of, but then once you actually get a hold of him, he is really helpful, and he has walked a few of you guys through some tricky situations. So some rules to go along with the EBT machines. EBT cards are debit cards. They're not credit cards. So they have to have a PIN number to run the transaction. You should never ask anyone what their PIN number is, unless you're 12 and you want to buy something with your mom's debit card. But definitely do not ever ask a customer what their PIN number is for their EBT card. What you do is you use something called an offline food voucher if you can't run their card at the time they're making the purchase, which I've got a video coming up here in a minute that will go into that in more detail, but just general rule, don't ask for the customer's PIN number, use an offline food voucher. I already talked about how the EBT machines have geolocation in them. So if you need to use your EBT machine at a time or a place where FNS is not aware of, just give them a call and be like, hey, we moved our market location and we're going to do it at this time instead of the other time, but don't share machines with each other. If you need more than one, then we can talk about technology solutions for that. But they shouldn't be shared unless you have permission from the USDA. Sometimes that will happen. Another thing about an EBT machine and SNAP customers is that there's something called the Equal Treatment Act. SNAP customers have to be treated exactly the same way as all other customers, and that means in good ways and bad ways. So if you can't discriminate against them, right? Like you can't be like, you have a SNAP card, so you will get less equal treatment, but you also can't do it in kind of like a good way either. Like you can't give them extra benefits other than the double up incentive. The NMFMA gets a waiver through our grant to provide extra benefit to SNAP customers. If you want to give an incentive or an extra benefit to your SNAP customers, you would also need to go through the process of getting a waiver. So there's more information about that on the USDA's website if you're really interested in it, or you can ask those questions. And then the Farmers Market Coalition has really great resources on their website for direct sales outlets and farmers markets to run successful SNAP programs. David and Anna, you have a question?
Yes. So in terms of the equal treatment thing, one of the downsides to our downtown farmers market in Santa Fe is parking. There's paid parking all over. We've had the conversation of, are we able to provide vouchers for people who are using their SNAP or EBT cards?
Not unless you're going to give vouchers to everybody.
Everybody. Okay. Thank you.
Yep. Any other questions about any of this? Okay. And then, so this year we've got a new GusNet program instead of the old Finney program, which means that we've got new contracts. So if you're an existing farmers market or other kind of outlet and you haven't sent me a new contract, signed contract back, I need to get those before your outlet opens. If you need a new copy, I can resend it to you. I sent them kind of like in December, so it might have gotten lost or forgotten about, or just generally not paid attention to, which is okay because it was December. But if you need a new copy, let me know. I'll resend it. I just need them back before you open for this season. If I don't have a copy of the contract, then I'm not going to be able to send you money for any transactions that happen. Same thing if you're doing FreshRx, it has a separate contract. She can't send you any money. We need a new one every time the FNS number changes, and I do not have applications and sign up available right now for like you guys to tell me when you're going to be open and all of that stuff, but it will be available soon. And so look for that coming in your email, and I'll also put it on the Market Manager portal.
And the good news is the contracts, unless the FNS numbers change, are good for the life of the grant. So you've got 3 or 4 years before you have to really stress about it again.
Yep. And then if you're a new outlet, or even if you're an existing outlet, we've been seeing so much growth over the last couple of years, right? Like we've just exponential growth. This is kind of an idea of how many tokens that you should have on hand. So if your farmer's market is doing 10,000 or 20,000 a year, you're gonna need 4 to 8 to 10, maybe even SNAP tokens. And so you can check out this chart. Kirsten's telling me that we're getting low on time. So you take a screen cap or take a picture with your phone or download the slides after the presentation. That way you can think about how many tokens that you might need. If you're a new outlet and you have questions, let me know. But the existing markets, if you don't have this many, let me know and we'll order you more. So this is kind of a timeline for new outlets with FreshRx or Double Up Food Bucks. You'll apply to participate and we'll get all of your information set up. And you'll need to start applying for your FNS permit. If we don't have that by the 1st of June, then you can do the program next year and just offer SNAP at your outlet for this year. We'll send your contract to FNS. And then when FNS approves your participation in the program, then you can start offering the program at your outlet. Just because you send us your signed contract, we still have to wait for FNS to approve you, which takes about 2 weeks, sometimes 3 if they're really busy. So it is a process. It takes a little bit of time. So don't wait until like May. Start thinking about it now.
All right. Well, we thought you all would get kind of tired of listening to us. So Sarah and I came up with the idea of creating a video for us to watch together. Again, it's more than nitty gritty. And it is something that can live on our YouTube channel and maybe even on our manager portal, so that people can watch over and over again as they have questions or as new market managers come on, or maybe you have a board member who's curious about how to do things at the market. So this will be sort of a go-to document for all of us. We had other folks narrate it, so you get a few other voices. We thought what we'd do is we would play a section at a time and pause and take questions and discuss the actual runnings and doings that we're talking about in the video as we go along, rather than just watching the whole thing at once. We're going to kind of skip over the vendor training part of this video right now and dive deeper into that this afternoon, because we know it's your favorite part of running the programs. And with that, here's the video.
Well, we're also going to do another Mentimeter during this. So you can go to minty.com again, but this time put in 2261445. And the question is, what are your biggest challenges connected to running SNAP, Double Up, or FreshRx at your outlet? And Kirsten put that in the chat.
Thank you for having Double Up Food Bucks or FreshRx at your market.
This video is meant to help you keep the programs running smoothly on market days and throughout the season. Let's get started with some opening procedures. Before opening your market, get your market manager binder ready for the day. Have a daily customer record sheet and a daily vendor record sheet ready to go with you at market. Have tokens out. Some markets find it helpful to have tokens pre-counted into bags. Make sure that the market's EBT machine is in working order. If it's not, use an offline food voucher to process transactions. These must be processed within 15 days to receive payment from the USDA. During market, Make sure that vendors have signs on display and encourage them to post their prices. Make sure that promotional materials such as brochures, posters, and banners are on display.
Does anybody have any questions about that part of the video?
I have a question. Let me know in chat if you did not, if you're an existing FreshRx market, if you did not get Sharpies in the mail. Because my muse is George Torres, and he has informed me that my tokens are kind of not so great. And we looked for a low-tech, quick solution. If your customers are confused about the SNAP token and the FreshRx tokens, I have sent you purple Sharpies in the mail. Go along and edge them with the purple, and we're hoping that that low-tech, quick solution will help you out, help your customers out and help you out at the end of the day when you're trying to sort tokens. And if that is just too much work for you, you can send me your tokens and I will sit and watch television and edge the tokens myself and send them back to you. Just reach out to me if it's a problem.
And we've got a question from Loretta.
Yes, where do you get the offline food vouchers?
They'll come with your EBT machine, or you can contact your EBT machine provider to give you more.
Now, fill out a daily customer record sheet. When an EBT transaction is made, fill out the record sheet. If an EBT customer does not get double up food bucks, still record the transaction with 0 in the double up food bucks column. Never give out more double up food bucks than SNAP. It is always a 1-to-1 match. One common error that many market managers make is matching the double up incentive with something called TANF, Temporary Aid for Needy Families. These show up as cash benefits on the customer's EBT card. Make sure that you only give double up incentives to customers who are using their food stamp benefits. FreshRx customers do not make EBT transactions. Rather, they bring paper vouchers to market. Record the value of the voucher in the FreshRx column and the FreshRx patient number, where you normally record the last 5 digits of an EBT card.
All right. Any questions about customer record sheets and how to record SNAP, double up tokens, double up value, and FreshRx value from the markets?
So something you should all be aware of. The customer record sheet's going to look different depending on which programs you run. And I know that's kind of a confusing thing, and I'm not sure there's much we can do about it. If you run FreshRx, you want to make sure your customer record sheets have a FreshRx column. Some of the really resourceful market managers last year created their own columns because they were using their old record sheets.
And then if you're running a single point of sale outlet, your customer record sheet does look different. It's got the first column is SNAP, the second column is double up, and then the third column is total transaction amount. And so you can write down how much you actually swiped their card for, how much of a discount you gave them, and then the total of what the transaction should have been, just completely. That way you don't get confused about how much was which, and you don't use a record sheet that has something about tokens on it because you don't have tokens. And then if you are a single point of sale outlet that has FreshRx, which is not, I think it's like 2 that might maybe ever use that customer record sheet, there is another one that has another column for collecting the vouchers.
Carrie.
Yep.
Yeah, I had a quick question, and maybe you're going to get into this later. I know when Double Up Food Bucks first started, there was like a weekly limit that it was like, I think it was $20. is that still around, or is there no limit?
There's no limit now. Any sort of limit at this point would be around, do you have enough tokens to make the transaction? Like there was 1 year, someone was gonna buy a pig, like a whole pig from a SNAP vendor, and they needed that many more double up tokens. And so the market manager called and they're like, so we have this customer and they're gonna need a lot. And so I did send a lot of double up tokens, and I imagine that they eventually got spent because it's been a couple years since then, but there's no limit at all. If you feel like you're getting low on tokens, let me know and we can order you more.
And Russell and Virginia are asking, is there an electronic customer record sheet?
No. And Zoe, can double up be used for me? No, what happened was the customer paid with SNAP tokens for the meat. And since the pig cost like $300 or something, they got $300 of wood SNAP tokens, but they also got $300 of double up tokens. So the SNAP tokens went out from the market manager and almost immediately back to the market manager through the vendor. But the SNAP tokens that the customer, the double up tokens, that customer clearly did not buy $300 of vegetables that day too.
And the paper customer record sheets are basically a reality. Most markets, we could create one if you feel like somebody could enter the information quickly enough onto a tablet or onto a laptop. But in our experience, most people want the paper because they have a line of people out in front of them, and they're just trying to get it done quickly. And it seems to be most efficient in the moment on paper with a pen and in a binder.
Okay.
Next, fill out the daily vendor record sheet. When a vendor brings tokens back to you for payment, write down the required information. If the vendor hasn't completed training, please have them do so before payout. If problems come up during market that cannot be resolved by referring to your market manager guide, please call Kirsten Hansen at 505-690-1529 or Sarah Thompson at 410-402-0363. We're here to help. After market.
All right, rail yards.
So yes, I have a question about the record keeping for FreshRx. I thought scanning that QR code kind of was part of that record keeping, so we didn't do the physical one, but we scanned it and put our outlet and that customer's ID for every single one. So I was just curious if that qualified as keeping records or if we needed the paper one as well.
So we're going to rethink things this year, and we're not going to have you scan a QR code for the FreshRx vouchers. The idea behind that was so that I could almost in real time communicate with the clinics about which patients were bringing vouchers to the market. And they just did not want that level of detail in their lives. It was more than they could handle, especially during COVID. So going forward, at least this year, no more QR codes on the FreshRx vouchers for you to scan. It should just keep it easier. So just treat it kind of like an EBT card, write those numbers down and write the amount down. I really appreciate that you save the vouchers and send them back to me at the end of the year, because it's sort of a second way. If something's wonky in your bookkeeping and the vendor record sheets or something, I can then count the vouchers and kind of make it reconcile that way. We will be adding a little line there for the date, which will help me tremendously at end of year. If you just at the end of the market day, put the date on each of the vouchers that came in that day, that'll be another way for us to keep track of things. We'll see. It's a work in progress. We'll make it work, but for now, no more scanning QR codes. My little gift to you.
Rhonda.
Joe, Rhonda, you want to enlighten us?
There
Am
she-
I okay? Can you hear me now?
Yep.
Okay, sorry, I don't want to get ahead of you. So, but there was something in this little snippet that said the vendor needs to complete training. And I don't know if you're going to talk about that training later, but what are the requirements for vendors who've already been through training versus those who haven't? How will that be worked this year?
So this afternoon, we're going to go into all of the vendor training in depth.
Okay,
Yeah.
that's fine. I just I wanted to put the question out there in case it wasn't going to. Thank you.
Sure. Yeah. It definitely we're just kind of skipping over that part right now so that we can give it all of the attention that it needs
And
this
because-
afternoon.
Because it terrifies us. We don't even want to go there, but we'll get there.
Okay,
And then there were two other questions in the chat that I don't know if you ladies saw. One was, can meat be purchased using Double Up Food Bucks? And the other was regarding whether farms can utilize these programs if farmers are selling directly from their farm.
So I answered about the meat. SNAP tokens can purchase meat, and Double Up tokens are only fruits and vegetables. The other question, can farms utilize the programs? If you go to FNS and you get an FNS permit, then you can have people come to your farm and make purchases. They have to happen at your farm, right? So you can do Double Up and SNAP at the farmers markets and have the farmers market be the EBT machine owner, and just use the tokens. If you wanted to have it at your farm too, then you need your own separate machine, and then it is effectively a 50% off discount for only the eligible items. So let's say that you sold somebody like a couple of jars of honey and then $6 of produce. You'd charge them for the full amount for the honey and then do a 50% off on the produce. So you'd swipe their card for 3 of the produce and invoice the NMFMA for the other $3.
It sounds complicated, but there are actually farms making that work.
Yeah.
Yeah.
And then we've got a question from Orion, and then after that, Casey.
My question is for the FreshRx. So as a new manager, I wasn't really prepared for what that all entailed, but I think a third party services that distributes those vouchers and then we'll reimburse our market. I think that's how it's traditionally been because they work with the clinic. But I was just wondering, so I was just wondering how, if you didn't get reimbursed or you were expecting to get reimbursed, can you I guess, if there's a problem, how do you resolve that?
Orion, I'm not sure you're talking about the same program as mine. There's this fabulous program run by COPE. Carol, are you here? Out toward your end of the state. They are sending vouchers through health clinics as well. Kaimi Thomas at COPE runs that program. Those are probably the vouchers you're seeing. I'm wondering if either Kaimi or Carol's on this call.
So I'm on the call. This is Carol. And Orion, that was a communication issue with Trini. So that's something that we had no control over, and you and Trini need to be in closer communication on the reimbursement because we were ready to reimburse and she wasn't responsive. So that's just a little step we all need to work through, and everybody gets busy, and so we just need to look at the process. And so the confusion is that yes, COPE has an FVRX program. It's run through clinics on Navajo Nation, whereas the FreshRx program that Kirsten is running has been originally centered more in Albuquerque and gone out to some of the clinics as well in your area. So there's some overlap, and that's confusing.
but they're separate programs, and we have the paper vouchers currently versus those tokens with the beats on them that Kirsten has. So
Yeah, so Orion, if you want to play with us, my particular program, it's a different process. I kind of, we have the whole contract process and the MOU, and you would know if you were running my program by now, and would love to have you someday.
So, and also, just so like everybody else knows what we're talking about, the only nutrition incentive, like the SNAP and Double Up kind of program that's in New Mexico, is the NMFMA one. There's another section of GusNIP grants that is fruit and vegetable prescriptions, and COPE has theirs and we have ours, and they're kind of in different geographic locations. But they essentially, like, somebody is going to a doctor's office and getting a prescription, and then they're taking that and redeeming it for food, fruits and vegetables. And the rules are different, and our vouchers look different than COPE's vouchers look like. And we also have the tokens with a beat, and there will be a picture here coming up in a second of what our vouchers look like, and they're definitely different. So if you ever have any questions about that, you can ask us, and if they're ours, then we'll answer, and if they're not ours, then we'll shoot you in the direction of COPE so that they can answer those questions. But if you're not near Navajo Nation, then that's probably not gonna be something that you see, or it could get to be confusing.
More questions there?
Yep. Casey?
Hi, yeah, I just had a comment I wanted to share around the question of can individual farms sell their own produce using SNAP and Double Up food bucks? And
Casey
that
is a
was
good
something that
person to
I'm
answer
gonna
that.
I'm sorry?
You're a great person to answer that.
Yeah, so I'm currently managing a farm called Chispas Farm, and we were approved to participate in the SNAP program. We have our own wireless machine, and we also do the Double Up Food Bucks program. And long story short, what Sarah was saying is accurate. You basically just apply for the food stamp programs as a farm stand and enter in all your farm information. It's very straightforward. I'm happy to share a presentation with folks who are curious about how to make that happen that I put together for the American Friends Service Committee called Farm to Food Stamp, that really just like step by step can help walk you through everything that it takes as an individual farm to offer food stamps directly on the farm. So I'll provide my email here in the chat for everyone who might be interested in that, because it seems like it's pretty hard and there's some languaging you have to be aware of, but really it's not that bad. And I've loved having it on the farm. So I'll go ahead and share that for everyone.
And I was in one of the presentations that Casey gave about doing it at your farm, and it is a very good presentation.
Yep, you're recorded in it and you'll be a part of it.
Rhonda, did you have another question?
Yes, I do. Several of us, I don't know how many of us, got these new machines for the FIS machines. Nothing came with it. Are we supposed to do anything? Are we supposed to do any special testing? How does that work?
So you'll have to contact Mark Nelson about that. Anything more than what's on the postcard that you also got, I know what the postcard says, and that's all I know. So you'll have to contact Mark.
I have something to add to this too, actually, if that's okay. And that's that he probably didn't get your information, because I had the same thing where I was like, where's my new machine? Just resend the information, make sure he got it, and they'll send it really quick. I got it less than a week once I double checked and realized I never actually sent the email.
Well, something happened because communications to FIS, that confirms what I've had. They called me a week ago and they said they never got my response. And then I got the machine within a week, but as I said, we got nothing with it, and we will call them.
Yeah, we wish that we could be in their heads. We really are just sort of in the middle with no power. We can say nice words and try to lubricate the wheels, but we can't really fix anything.
Okay.
Yep. George, do you have a question?
I do. The box that the machine came in had a full 12 or 30 page booklet that came with it on how to operate the machine. Also, there was one leaf overlay for the machine on the process of what to do with it and how to add anything that you needed to do to make sure that machine operated.
Okay, so if anybody didn't get that booklet and paperwork that George is talking about, you should call the number on the postcard and find out why you didn't get one and ask for a new one.
It was there. We didn't see it.
was
Thank you,
buried
George. It
underneath.
was buried.
Hey,
under
George.
the block. Appreciate that.
Excellent.
Do we have any other questions before we move on? All righty.
Shiprock has their hands up.
Oh, who does?
Shiprock.
Oh, Orion, did you have more questions or is your hand just still up?
Oh, I think it was still up, but I kind of didn't really get my question answered, because if you're like a new manager or a new market and then a voucher or some program that existed in the past, that it comes directly to if the farmer gives it to you and they're expecting to get paid and you're not fully, like, I guess, working with those partnership organizations, or there isn't an MOU or something figured out beforehand, then I guess that's a part of like conflict resolution. And then because the farmer, they're participating in good faith and they want to like get paid, and you're like, well, I didn't
Sure.
know.
Well, let's set up a meeting to talk about that at a different time, just because I think this is more of a one-on-one conversation. So
Okay. I'm wondering how, like, are you obligated, since these are federal programs? Because like,
Yeah,
do you
it's really tricky, with the, we'll have a separate meeting, but the hard, nasty answer, and we're not going to stick to this 100%. The hard, nasty answer is these are federal funds. Nothing can happen we cannot reimburse anybody without an FNS number and an MOU on our side between the two of us, the two entities. Those things are really important. Furthermore, no reimbursement should happen unless the vendor has been trained in our programs. So that's part of why, we're here to hold your hand, but Orion, we can definitely have a conversation. We're also not in the business of pushing people. So there's wiggle room, there's conversations to be had. But let's do it, over a Zoom call, just with whoever else has these same kinds of questions.
and we'll also, at least I will, I don't know if Kirsten will, be at the Northwest Growers Market Association meeting next month.
See, I don't know nothing. There's another question. Will our outlet need to get a new EBT machine to accept the new digital cards?
I think that is something for the WIC folks to discuss tomorrow.
Yep. Another one from Sally. I have a couple of questions about the SNAP application that might be better answered outside the meeting. So Sally, let's follow up with that, okay?
You'll need to use the EIN, your own EIN, and not ours, but you can get one of those, and we can definitely have a conversation about the rest of those questions on a separate meeting. Just send us an email and we'll get something scheduled. Rhonda and Joe, do you have another question, or is your hand still up? Okay. All righty.
Close the day by printing a batch report from the EBT machine. Here's an example. This report will show the total number of EBT transactions and the total amount of EBT transactions that were processed. batch report should match the customer record sheet. If you forget to do this, you may be able to obtain a copy by calling your EBT machine provider. Attach the batch report to the customer record sheet. Make sure that the vendor record sheet is complete and accurate. Fill out the digital vendor record sheet if you are using it.
The online Market Manager portal is a great resource for keeping Double Up and FreshRx running smoothly at your market. To find it, go to doubleupnm.org and navigate to the Market Manager login. The password for the site is Apple. Here you can find materials for every market, as well as materials based on which programs your market participates in. There are resources to help you train your vendors and to keep track of transactions during the market day. There are links to online monthly reporting and forms to help with end-of-year reporting as well. There are even materials to help you promote Double Up at your market.
Tracking how much money customers.
Okay. I couldn't find my notes. Does anybody have any questions about batch reports? Or closing for the end of the day?
We look at those batch reports. They're important at the end of the year. So it's really in your interest to print one off at the end of every market day. It's how we make sure the customer record sheets match up.
And we, in the end of your reporting, like checklist that's in your binder, it's called third-party verification of sales. And it can be sometimes not a batch report if you've got a EBT machine that's not just a standalone EBT machine, like you're using a Clover or some sort of other point of sale system, you might be sending me just a report instead of a batch report. Or if sometimes like you'll lose the EBT batch report, like it'll blow away in the wind, or your dog will eat it, or something crazy happens and you don't have it anymore. You can get information like an Excel spreadsheet from your EBT machine provider, which is usually FIS, or if worst comes to worst, you can send merchant copies of every transaction, but that's definitely like,
don't do it.
Yeah, you can't get another copy somehow from somewhere else, because for us to check merchant copies of every transaction for every day that your outlet is open, which is, sometimes once a week for 16 weeks, that's 16 sets of merchant copies to check, but sometimes you're open more than once a week and you've got 30, 50 transactions happening every day, and that's very, very overwhelming for us to check. Carrie.
Yeah, I'm sorry if I missed it. Did you guys answer Sally's question? I know
we would encourage her to reach out to us, but the EIN number has to be your own. It cannot be ours.
Okay, thank you. That's I just wanted to make sure that was right.
Yeah, it's not difficult to get an EIN, but I think it's a little bit more detailed than we want to get into here.
I think there's some amount of people being nervous about having their names associated with the numbers. I know people are nervous about that, but in reality, we haven't had problems with that. We haven't had people's information being misused. I understand that you can be a little hesitant, but in reality, most markets function just fine having those numbers associated with one person, and it just flows. And then the real problems only arise when that person leaves and nobody lets the authorities know. That's when the problems arise. It isn't parking your name and information with the authorities. It's when somebody leaves and we have a new person in there and the numbers and the names don't line up. That's when problems happen.
Yeah, and as much as like the person whose name is on the machine is technically responsible for what's happening on that machine, you also at the same time have to remember that like at Smith's, at Albertsons, at Walmart, there is somebody in a boardroom somewhere that has their social security number tied to the hundreds and thousands of registers that their company has. So like if you swipe your EBT machine, or I'm sorry, if you swipe your EBT card in Washington State and in Florida, there is one person at Walmart who would be responsible for that. That one person at Walmart is not responsible for what thousands of cashiers are doing. So yeah, your name is on it, but also remember that that's how it is everywhere, and you have a whole lot more control about what's happening with the 20-50 people at your market compared to thousands of Walmart employees or Smith's employees, Kroger, whoever. So
okay. We did get our own EIN, and I just wanted to, because that's kind of, we've been round and round as a market about that. So I just wanted to make sure. I was like, oh no, we did it right, didn't we? So I think we're good.
Sure. Yeah, that's reasonable, especially with everything you guys have going on.
Orion, what's up?
Or is your hand just still up from before? Nope. Okay. Any other questions?
Hey, if you have a second, raise your hand if you've ever used our, we'll get right back to you, Rhonda, but first, if you've ever used our portal there with the market manager portal, have you ever used it to go and pick things up, raise your hand and let us know, because we feel like it's an underutilized resource out there for all of you.
So I have a question. This is Joe at the South Valley Growers Market. Last year I had a woman from Pennsylvania who bought some EBT tokens. Is that acceptable to do that?
Absolutely.
Okay.
Yeah.
People are visiting from out of state, it's okay as long as they got a legitimate card and I can record the 5 digits off of their card.
Yes. Okay. Yeah. There are a very few states that don't have agreements that say that their cards can be used in another state. But if that happens, it's just going to say declined. When you swipe their card, the machine will say declined and it won't actually run anything. And the receipt that comes out will say declined, $0, all of that. So yeah, as long as it runs and gets accepted, then just write down their digits and
I've had cards that were declined, but also I had an experience last year with somebody who had only a portion EBT card with no numbers on it. And I refused to process it because there was no way for me to record the card number because I assumed it was stolen. Have you ever had a case like that?
Was it one of the pandemic EBT cards for like the school kids?
No.
Like those white ones?
No, it was just looked like a New Mexico EBT card, but it was only half a card there.
Yeah, don't blame you.
Yeah.
Don't blame me at all.
Numbers, so I told her I couldn't process it because there was no way to record the numbers. So I assumed it was stolen.
That's fair. Yeah, I mean, I think a customer who you can't read their card, they should call and ask for a new one. I don't blame you at all.
Well, all I know is there was no number to record, so I couldn't process it. Thank you.
Yep. Reba, do you have a question? Or you still got your hand up because you know how to use the portal?
Yeah. If you think,
sorry, yes, I know how to use the portal.
Yeah, there's a lot of great hands up there. Thanks everybody for letting us know that you actually use the portal. And you have the portal and the binders we send out. Hopefully those are super helpful in the moment. If Sarah and I are not picking up our phones because we're out eating lunch together.
Also, one time I was thinking about that this morning. One time I was at the downtown growers market and Saban called me from Grants because she was having a problem with her machine, and I went to the information booth at downtown in Albuquerque and just looked up the answer. So it's good to have with you at the market too.
And then Pam's asking us to just chat about the portal again. What do you want to say about the portal, Sarah? It's easy to navigate to.
Sure. So you go to doubleupnm.org and you can scroll down to the bottom of the page and click Market Manager Login, or you can go to doubleupnm/market-manager and then enter the password Apple. When you get on there, the first orange box is for vendor training related things. The next box after that is for reporting related things. So it's got the online reporting, it's got token tracking. So you can enter information about how many double up tokens you've got. Some of the other things that are available on there is copies of your manager guide. If it's a manager guide for a single point of sale or a farmer's market, training resources. The video that we're playing right now will be available. This training that we're doing right now will be available. There's a link to the NMFMA online store where you can buy, or not buy, but like order, aprons or posters or anything double up related. If you're not signed in to the New Mexico Farmers Market website, you're not going to see all of the available items for double up in the store. But if you log in or you make an account for yourself, if you don't already have one, then you'll see all of the available things that you can order. That's, new little pouches to give to customers with their tokens, or posters, banners, pretty much anything that you would, the A-frame signs. If you don't have an A-frame sign, like there was a picture of one earlier in this video, you should definitely order one or two, because we want our storage unit, which was my old office at the office, to get cleared out. And also like half of my porch is taken up with A-frames. So you should definitely order some and arrange to receive it.
Looks like we have a question from Cuesta.
Yeah, I think we have like two questions actually. So one of them is, and Casey just asked a similar one. What's the process for giving double up food bucks to people who use an out-of-state EBT? And then the second question is really like, because we're on like the northern state line, we sometimes have vendors from Colorado. Can you explain what they can receive?
Okay, so an out-of-state EBT card, they can get, if they get SNAP, then you give them double up, just the same as normal. They need to know that they can only use the SNAP tokens at your market and the double up tokens at a New Mexico farmers market, right? So they could go to Taos and they could spend them there, but they can't go back up into Colorado. And one good thing about the Colorado program of double up and the New Mexico program is Colorado has like little monopoly dollars for double up, and we have the tokens. So they're not going to get confused. Like a customer who has both is going to know which one is which. There's nothing tricky about that. A vendor who comes from Colorado with produce that they grew in Colorado, they can accept SNAP for their produce, but they cannot accept double up food bucks. However, if the person lives in Colorado, but they grew their produce in New Mexico, then they can take double up food bucks. If the food was grown in New Mexico, double up. yes. If it was not, SNAP only.
Thank you.
Yep.
All right, let's jump into end of year reporting.
Customers spend using SNAP, Double Up, and FreshRx is essential to keeping the programs running at markets around our state. Funding for the programs depends on the NMFMA being able to communicate with local, state, and federal government agencies and donors about the financial impact of the programs. End of year reporting is how we keep track of it all. End of year reporting is due 14 days after your market closes for the season. If you run a year-round market, reporting is due January 15th. The first step in reporting is to gather customer record sheets, batch reports, and vendor record sheets for each market day. The vendor record sheets should be compiled into a vendor summary sheet showing the vendor's name, business name, vendor ID number, zip code, and totals paid out for SNAP, Double Up, and FreshRx for the season. Next, make sure to count your tokens and record the number on the end of your checklist or by entering information online by clicking on Beginning and End of Year Token Count on the Market Manager portal. Once you have gathered all the records, you can upload them using a link supplied by Sarah Thompson or Kirsten Hansen, or you can send them to us in the mail. FreshRx vouchers should also be gathered and mailed to Kirsten. Sarah and Kirsten audit all the records you provide and then determine whether your market is owed money or whether money should be returned to the NMFMA. This reconciliation is an important last step in the end of year reporting process.
Once you have completed all the end of year reporting, you're ready to head into another market season. Double Up and FreshRx wouldn't happen without market managers in dozens of New Mexico communities paying attention to all the details and making the programs work for farmers and customers alike. Thank you for all you do, and here's to a great season ahead.
All right, do we have any questions about end of year reporting? Loretta? Oh, Loretta, you're on mute. We can't hear you.
Yeah, we had some trouble last year. We had new people in and stuff, and I don't think that our end of the year reporting got done. Is that a problem or?
Which, I mean, yeah, which market are you with?
Socorro, I'm sorry, Socorro. You tell me what's going on.
So definitely a secondary conversation, but I think,
yeah,
and Kirsten, correct me if I'm wrong, I think that we're okay.
We resolved it. We worked it out. Yes, it's a problem, but that's what we're here for, is to help you all work through problems. Yep.
Also, if anybody else wants to know what happens if you don't turn in your online reporting, we send you letters about, we email you a lot, and then we'll send you letters in the mail. And you can't, like, an outlet can lose our programs if you don't do end of year reporting, but we'll definitely, even if it turns into something that's like an overwhelming situation, we'll work with you. Removing an outlet is very much a last resort, but it can't happen. It's very, very mandatory. We can't, like, the NMFMA does not get reimbursed if you don't turn in this paperwork. So we can't reimburse you if we don't get reimbursed. Chris, you have a question?
Yes. We have a print waiver for SNAP and EBT, and I saw that they're, collecting all those records. Are we required to have print records for New Mexico Double Up and FreshRx?
So you'll only be able to do Double Up for now, but the even if you have the print waiver, which is fine, you should be able to run a report from your computer or your phone that shows what the totals for the month. As a
Yeah, we
single point
plan to
out
integrate
sale
that and
outlet,
do all
it
that
doesn't make
digitally,
sense to
but
do
we
like
don't
a
plan on keeping
weekly or
a lot of
daily one. So you would just run a report at the end of the month.
Okay. But we don't have to have the handwritten reports. We can do that digitally, and because we're working on some back end stuff to automate a lot of that.
Yep.
Any other questions about end of year? We'll talk more about it, I'm sure, but the deadlines do matter because there's a lot of outlets. And even being a week or 2 or 3 late with your reporting, it doesn't sound like a big deal since we're thinking about a whole year, but it does impact the way we get things done. So the closer to the deadlines that we all can get things in, the better off we all are.
Yep. So if your outlet closes in September and you end up not sending your end of year reporting until November, then I don't get to spend Christmas and Thanksgiving with my family. Okay, so like, please make sure that you're sending it in within the 15 days. It also, like, if your stuff is due in September and you don't send it till December, late November, January 15th, we're working on the end of year outlets at that point. And so there are a couple of year-round outlets that we haven't finished checking their records from last year because there were so many outlets that sent records in, like a month, 2 months, 3 months after they were supposed to. And so it's really critical that you're sending your stuff when it's due, which is 15 days after your outlet closes, or if you're year-round outlet, then vendor information is due on January 10th. Everything else is due on the 15th. And if something happens like wild that makes it so that you can't make your due date, let us know. And that way we can be prepared for your records being late.
Oh, you want to do
Is
the
it
next
ready?
one?
Okay, so that's the end of the video, and I'm gonna stop sharing my screen so that Kirsten can bring up our results from the Mentimeter. So the biggest challenges that you guys have about running the programs, nothing is really big on here. That means a bunch of people said that, which is kind of exciting.
Vendor training is really big too.
Yeah, we changed the way vendor training is done last year, and we'll go into that later this afternoon, and should be a whole lot better this year than it was last year.
Too much bureaucracy. We hear you. We're going to say straight up, there's nothing Sarah and I or Denise Miller can do about the bureaucracy. We are stuck with it. We feel your pain. It's, it really is as part of being part of these programs. We can always push back on our national calls and things like that. But to be honest with you, the bureaucracy exists, and it's just a lot bigger than any of us. And I don't really think it's very movable, but we can keep trying. It's just, we did not create the rules. We did not create the paperwork. We did not create the reporting. We're just really implementing them.
And any really big changes to how the program gets run and what information that we have to have, or what the eligibility is, that gets decided with the Farm Bill. So it'll change every 4 years, and then it won't be immediate because we'll have to wait until it's time for us to apply for a new grant, and then we can change rules. So yeah, a lot of it is out of our control. Like nuts being, like pecans being double up eligible is that's a federal situation with the Farm Bill. It's not with us.
We understand the math problems too. We suffer from math challenges. Length of lines, we hear you on that. We're wondering whether we might be able to, for larger markets, actually have 2 EBT machines instead of 1, to sort of address some of those long lines. Would love to hear anybody's thoughts on what to do about long lines, how you handle them at your market. Does anybody want to come off mute and tell us how they handle long lines at their market? Go ahead, Casey.
You raise your hand?
Did you, I'm Casey from the Rail Yards. I didn't know if you met me.
Uh-huh.
We were trying to get our second EBT machine up and running last year, and I had a very hard problem with it. Do you have any helpful advice on that?
Were you working with FIS?
I was, and they kept they kept getting me to run their sample code or whatever, but one would log on and then it would shut the other one off. So it's really hard to get both of them working. And I called the FIS people, and the farmers market situation is just kind of hard for them too. They didn't really quite understand it, but I just had a hard time getting both up and running. So I didn't know if you knew anything about that.
Can you send me details about, like who you were talking to and what they said and what?
Yeah, I mean, we just got our new machines too, so I'll try it again. And if I have any problems, I'll email you.
Okay, because if that's the case, I'll bump it up to the Human Services Department. Sometimes we get a little bit more movement when they ask instead of when we ask.
And thanks for being the guinea pig.
Yeah.
No
There's
problem.
also, depending on if a market has the cash flow to do this, there are other programs. There's a new app for the phones that seems to be a promising workaround, but it's not free the way that the FIS machines are. So let's see.
Anna and David.
So we have 2 machines here at the Santa Fe Farmers Market, and pre-COVID we had 2 lines. That's how we dealt with it. And we had a volunteer or 2 volunteers who would be counting the tokens while the machines would be running. Once the pandemic happened, we went down to 1 line, and the way we handle it, the lines, which we do have frequently 5, 6, 7 people for a half hour. 1 person runs the machine and the second person counts the tokens. So we kind of do a little conveyor belty situation, and that seems to keep the angry people in the line at bay. That's how we handle it.
Do you think that you'll be able to go back to 2 lines anytime soon?
We might consider it. We'll see how, once the summer starts, we'll see how the traffic is going to be, and then we can probably do again 2 machines, because we used to have 2 lines coming our way, and that was how we did it in the past. So that's our.
George, did you have your hand up earlier?
I did. The only thing that I can say on long lines is that just handle it as you can. Patience has a lot to do with it, and keep your people hydrated as they walk through your line. Hand them a glass of water or bottled water. That's basically all you can do.
Thank you, George.
Rhonda and Joe.
Yeah, it's Joe. And I think I got this idea from George, but I have prepackaged little baggies of tokens already counted out, so that speeds up the process. And I tell people I've got a bag of $10 or $20, etc. And it's always even numbers. If somebody says, well, can I charge $5? And I say, no, it has to be even number because of the $2 silver tokens. So anyway, that's something that others may consider. Pre-packaging in little baggies, there are a certain amount of tokens that they can offer really quickly. So that's how I deal with it.
Thanks, Joe.
I see that somebody wrote that they don't have equipment available, and that's the challenge. If you want to reach out to me via email, I could try and help you get something else happening for you. Sometimes there is not a good solution because there are some places that are just really rural and they don't have good solutions. then we've got Reba. And then we'll finish up for the morning.
So at Downtown Growers Market, we do pretty much the same thing, and our lines are often, 50 people deep the whole time. So yeah, the pre-bagging, I spend all Thursday night every week making giant totes of pre-bagged. We usually do 50 of each in each bag.
Fabulous. And we gave you handy dandy bags to hand to people too, to keep their tokens in. We hope you're enjoying the cosmetic bags. Because we sure are. They're taking up 2/3 of our office. There'll be more coming your way so that we can start moving in our office.
Yeah, my office in Santa Fe is a storage unit now.
We hope you like them. Thank you, everybody, for sharing. Who
I've got
else
a
have we
couple.
got? She's got more she wants to say. All right, I'm going to stop sharing so Sarah can tell you some more stuff. We're almost back. Yep, there we are.
Okay.
That
So new this year, but it's not new for anybody who's done FreshRx, but everybody else. We've got new reporting requirements that are fairly similar to what they were before. But like I was saying earlier, I've got to report to the NTAE, which is a third party that grantees for programs like ours work with, and the USDA works with, for monthly reporting now instead of quarterly. So your weekly online reporting or monthly, if your outlet is set to do monthly, is going to be the same. It's going to ask for your SNAP dollar amount, your SNAP number of customers, the same thing for Double Up and the new customers, but we're also going to ask how many fruit and vegetable vendors were present at your farmer's market if you have a farmer's market. If you don't, then this question will not be asked of you. Surveys are going to look a little bit different. Like we've had these paper surveys for customers and vendors in the past. Those will still exist, but we're going to have another survey that select outlets will need to participate in. And we've got a working list that will contact you individually or as a small group about, but they're more in depth, and the USDA is trying to find out a little bit more information about how Double Up food bucks and FreshRx impact people's lives. And so you might hear me talking about it even if your outlet is not on one of the ones that's going to participate in this longer form, but we'll have tablets and paper versions for if you want to do it at your outlet, or if you don't, then we'll have a QR code that customers can use to go take it online in when they're not with you at the vendor at the information table, because we know that you're so busy just running transactions that having another volunteer or you doing it yourself could get too overwhelming. So that's also an option. It's through a program called Qualtrics. So if you end up being one of the outlets that we're going to ask to fill out some of these surveys, we'll be in touch. And if you hear us talking about, or you hear another manager talking about it, and it's not happening at your outlet, then don't worry, you're not missing anything. You're not forgetting about something. It's just something that's happening at some, but not all. And are they 30 questions?
Mine are 30 long. For FreshRx, there are also surveys, but you guys are protected from that. It's all on the clinics, and they're about 30 questions long. So it does take a minute to fill them out. The good news is they've been filling out these surveys around the country, and people are able to document that folks are indeed eating more fruits and vegetables because they're getting FreshRx vouchers or getting tokens at the market for Double Up. That's actually working. And that is exactly the kind of data that Congress wants to see to keep giving us the money we need to run the programs.
And as other programs like ours around the country get on board with this new grant, the less that we will have to do because there will be more people involved to spread out the sample size. So that's also good. And finally, like I was saying before, due dates are going to be a lot more firm. So if you're one of the outlets who isn't so great at keeping up with reporting every month, just plan this year, set a note on your calendar, on your phone, something to help you remember to be doing it on a consistent, regular basis, at least once a month.
All right, we're running close on time. We're over 11.
We've got one more slide though.
One more slide. We had a quick question. What is FreshRx? FreshRx is a program that matches outlets with health clinics, and the health clinics give their patients vouchers to go to the market. They have their own tokens, and it's at just a few markets because we really need that health clinic partner to play. End of year, our audits. Yeah, we touched on this in the video. Again, if you're lucky enough to be a single point of sale, you really only have to submit a vendor list. Otherwise, if you can't do that, we're going to have to look more deeply. All these due dates are more strict this year. For the farmers markets, what I really want to emphasize about end of year is most of you send almost everything we need. And then there's a few key pieces of information missing, and it's different from market to market. This year, we're going to really emphasize people filling out their vendor record sheet, their vendor summaries, because that's the information that Denise is asking us for in January and February when she's trying to talk to the legislators. We know that it takes time, but paying careful attention to the information we need from about the vendors is really critical.
There's a Excel spreadsheet. So if you're comfortable using Excel, and that later when we're talking about the vendor training, it's a little bit longer of a video clip that you can see, but you put the vendor names in column A, and then there's a set of columns that like the vendor ID number and the zip code. And then there's some columns that total for the whole season, each vendor. And also if you scroll down to row 101, it also totals for the day. So if you don't want to be keeping paper records and relying on paper records for the whole year, there's also spreadsheets for farmers markets and single point of sale outlets that will do all of the math for you. So if you're comfortable using Excel, it's a technology solution to make things go a little bit faster, and you have to do a little bit less math.
Rail Yards is asking, is a monthly due date the 1st?
No, it's the 15th. So like if you have a market on the 30th, then it's due on the 15th. But if you finish your month earlier, then it's still due on the 15th.
And we will be talking a lot more about reporting later in the spring as we get a new back end program up and running. And we will definitely be in touch with all the details you need to know about how to report to us every month and every week. On that note.
Before we end the token count.
Oh, tell them about token count.
Okay,
Do it.
So if you are a farmer's market, you can count your tokens at the beginning, your double up tokens. I don't care about your SNAP ones. If you need more, let me know, I'll order them. Other than that, I'm not tracking them. With your double up food bucks tokens though, if you count your tokens at the beginning of the season and at the end of the season, or if you're a year-round outlet, just pick a date in the spring and in the late fall or the early winter and count how many tokens you have. And you tell us the beginning number and the end number. And then we're gonna check that information against your online reporting. And if it works with our formula, then we're gonna just check to make sure that you turned in the right stuff. and we're not gonna look at your records really closely, it makes getting your records checked a lot faster for us. You'll get your end of year check a lot faster. Everyone will get their end of year stuff a lot faster. And if you don't do that for some reason, like you're not able to, you lost the piece of paper you wrote it down on, whatever, then we'll be actually checking through every week to make sure that you reported the right information and checking every week's batch report. So we're going to look a lot more closely if you're not doing that. So there's a place in your end of year checklist that has space for writing down at the beginning of the year and the end of the year. There's also on the market manager portal a Google form where you can just go in and enter how many you have at the beginning and end of year. And if I send you tokens during the year, I got like a little receipt book, so you'll have a receipt and I'll have a receipt, and we can remember what happened. Sometimes things get crazy in the summer, so we definitely highly suggest doing token count at the beginning of the year and at the end of the year. All right, and before we break, I think Sophia has a few things to say. Thanks for your attention this morning, everybody.
Yeah, so thank you everyone for your time and attention. I know this is a lot of information to absorb. Please don't forget to come back this afternoon after we break for lunch. It will be the second half of the Double Up Food Bucks and FreshRx training and session. So also, if you're an NMFMA member in good standing, please don't forget to vote for those open board positions. So everyone enjoy your break. We'll see you at 12.
Bye, everyone.